Yeah. Good afternoon, everyone. I just want to, we will be starting momentarily. We just have the chair and the vice chair committee doing current bills and other committees at this time. So just give us about another 5 to 10 minutes and we'll go ahead and get started. I do think that we may have to change the agenda to accommodate some other folks who has to go to other committees. So just be prepared. Oh, here's the chair. We'll be gaveling in momentarily.
For being 9 minutes late. I was literally in the middle of a bill hearing, so I couldn't step away. All right. Madam Clerk, if you could please open our roll. Thank you so much, Madam Clerk. Please close our roll. I am going to call Delegate Helmer up first. Oh, Delegate Orrock, did you want to say?
Madam Chairman, I was just on a procedural motion at the request of the patron. Could House Bill 449 go by for the day? It's my understanding there's a companion measure working its way through, and we should get those together.
Mr. Delegate Orrock, that would be good to get them together. This is going to be, we anticipate, the last subcommittee meeting for social services before crossover. Amazing. So if once those two meet up, then we might have to ask to have them heard in full committee.
Yeah.
Second.
All in favor, say aye.
Aye.
Any opposed? Great. Thank you so much, Delegate Obenstein, for being here. Or House Bill 449 will go by for the day. Delegate Helmer has House Bill 278.
Thank you, Madam Chair. Members of the subcommittee, there is a substitute.
Move the committee substitute.
Madam Chair.
Delegate Orrock, I think you're going to ask if we can report the substitute first.
Well, if he could explain the differences before we act on it. I know we have access to it, but the folks in the room don't know the differences before we act, if he doesn't explain them.
All right. Thank you, Madam Chair. Madam Chair, the substitute, and we're going to make an amendment. We're actually going to ask after we adopt the substitute to make an amendment to the substitute. What the substitute does is put some guardrails in terms of the length of time on the underlying bill, and then makes sure that it gets the amendment we're going to. There's language in the substitute that will make sure it gets fully funded before we adopt it by the feds, and the amendment we're going to ask for that substitute will further clarify to very strictly ensure that before we adopt it. Yeah. Thank you.
Can we get a motion on the substitute?
So moved.
Second.
All those in favor say aye.
Aye.
Any opposed? Great. The substitute is properly before us. Delegate Helmer.
Thank you, Madam Chair. Madam Chair, with the substitute before us, I believe the clerk has an amendment to the substitute. If it would be the will of the committee to have the clerk report that.
Mr. Clerk, or Council, could you please report the amendment to the substitute so that we can hear that?
Yeah, Madam Chair, this would add a third enactment clause that would say that the provisions of this act will not go into effect unless the state plan amendment is approved by the Centers for Medicare and Medicaid Services and federal financial participation is available.
I
hope that helps with the FIS. Please proceed, Delegate.
Madam Chair, there are a number
Orrock.
of things we just did that should help with the FIS.
Madam Chairman, my concern, and I understand what the delegate's trying to achieve, but my concern is when you put an enactment clause on something of this type, then the law goes on the books. And it just goes as a notation in the law books that there's a star that depending on other action, it may or may not be in effect. We ran into this, Delegate Bell, I think some years ago, Delegate Albo had a circumstance where there was a provision, if it wasn't in the state budget, the law. So I'm going to go with it now just so we can kick this on down the road, not get in the way, but just I would share with the delegate and those in the room that when you put enactment clauses that say it doesn't go into effect unless something else happens, then it goes in the law book. People think it's the law, but if that other didn't happen, it isn't really. So I'll get with council offline, and we'll talk more about that too. But just want that explanation. Thank you, Madam Chairman.
Thank you, Delegate Orrock. Delegate Helmer, please explain your your amended substitute.
Yeah, thank you, Madam Chair, and I'll just add that that amendment was at the request of DMAS, so, sure. Madam Chair, the amended substitute now before us, House Bill 274, is fairly straightforward. Currently, if you are in Medicaid and you have cancer that will cause you to have iatrogenic infertility because you are of an income that requires you to be on Medicaid, you have no ability to access fertility preservation. And so the act of being poor and having cancer means that you may not be able to have a family. I think as a body on both sides of the aisle and on a bipartisan basis, we can see that that is wrong and that we can adopt pro-family policies that allow those who confront cancer to be able to go on and have children. That is all that House Bill 274 does, is it allows fertility preservation actions for those under Medicaid. It puts some constraints on there to really reduce the fiscal impact, and I hope this body will see fit to report the bill. Thank you, Madam Chair.
Thank you so much. Questions from the committee of Delegate Henson.
Thank you, Madam Chair. Just a quick question. This is House Bill 278, correct?
It is House Bill 278 and wrongly listed on the top of my little speech card over here. Thank you.
Okay, great. Thank you. Delegate Gardner had her hand up. All right, Delegate Auroch.
Will this measure need to go to approps? Okay.
Madam Clerk, I think we did get a letter originally, so we do expect to send it.
So not to cut off testimony, but I would then move that we recommend reporting and referring to approps, and we can still hear public testimony on the matter.
That motion's been, the motion has been properly seconded. I do want to give a chance to ask for public testimony. So I'm going to, I'm not sure what the right parliamentary words are, even though I have Delegate Auroch here. So I'm just going to pause on that motion, and we could consider public testimony to give folks a chance. But I think in the recognizing the time limitations, just know I think this has some favorable energy behind it. So if you're here to speak in favor of this motion, please line up. Or I'm sorry, of this legislation, please line up. Please keep your remarks brief so we can have everybody speak. Go ahead.
Yes, ma'am. Good afternoon. My name is Galina Barchena. I am the Policy Director for Birth in Color, and we fully support this bill. As you all know, a cancer diagnosis can require treatment fairly immediately, and folks really need the time to be able to make decisions about their reproductive futures. So we hope you support the bill.
Thank you so much. Good afternoon.
Good afternoon. I'm Dr. Harry Gawant. I'm a pediatric rheumatologist and president of Virginia Society of Rheumatology. We highly support this bill and would like to point out that people with autoimmune conditions get treated with a variety of medications that also affects their fertility. So this is not just for people with cancer. And you also have to remember that over 50% of the Medicaid population is pediatric. And so we're talking about preserving fertility for a number of people with very serious diseases and would have no other option outside of this bill. So thank you, and we fully support it.
Thank you. Good afternoon.
Good afternoon, Madam Chair and subcommittee members. Lexi White with Repro Rising Virginia and the Virginia Reproductive Equity Alliance, and we support the legislation.
Thank you so much. Is there anybody else? No. Is anybody here to speak in opposition to the bill?
Madam Chair, members of the subcommittee, Jeff Caruso with the Virginia Catholic Conference. And we're deeply sympathetic to the underlying situations that the delegate is trying to address. I just want to note for the record that, Medicaid, of course, is taxpayer funded. There is embryo banking involved as one of the things that could be covered in the list here. What that means is that, sometimes newly conceived embryos are created and they're not always implanted. So sometimes, later on they can be discarded. And in our view, that's a newly conceived human being, genetically unique. And so this would involve taxpayer funding of that. So I just want to note that for the record as this continues to move along the process. Thank you.
Thank you so much. Is there anybody else here who would like to speak in opposition to the bill? All right, so we do have a motion that has been properly seconded before us to report and refer to appropriations the substitute as amended. Madam Clerk, if you can please open the roll. Members of the committee, please vote. Right, please close the roll, and House Bill 278 has been recommended to refer as amended substitute to appropriations by a vote of 7-0. Thank you so much, Delegate Helmer.
Thank you, Madam Chair, members of the subcommittee.
All right, and next I'm going to ask Delegate Hernandez to come up. Good afternoon, Delegate Hernandez.
Good afternoon, Madam Chair, members of the subcommittee. So I have HB 855, and first want to note that I have a substitute and happy to speak to what that does. First, it removes some of the prescriptive language that was in there initially to help remove the fiscal impact. So in conversations with DSS and others, do believe now that this zeroes out the FIS. We also speak in greater detail to the regulatory process, essentially to help DSS move more quickly, and I'll say more about that in a moment, but that's what the substitute does.
Great, thank you. Can we get a motion on the substitute?
So move. Move the committee substitute.
Thank you. All those in favor of reporting the substitute before us, say aye.
Aye.
Any opposed? And the substitute's now properly before us, and council will work magic to get it online. But why don't you continue to tell us about your underlying bill?
Very good. So just by way of background, the Low Income Heating and Assistance Program, also known as LIHEAP, is a federally funded state administrative program to help Virginia families pay for their energy bills. The problem has been that the application window is truly heartbreakingly brief. For example, the application period for heating assistance runs from the second week in October to the second Friday in November. That window isn't just short, it's also misaligned with when people need heating assistance the most. So the solution that is contemplated in this relatively simple bill is to adopt a year-round application window. Other states have already done that, Maryland, DC, Tennessee, and others. The federal government, which again funds this program, has been encouraging states across the country to move to a year-round application process. And probably most importantly, DSS already is trying to move forward with regulation to open it up year-round. The issue is that process started over a year ago at this point. It still could be several years away to get to the finish line, and so this is something that would help them accelerate the process and hopefully get a regulation in place before the end of this calendar year. I'll just say when it comes to heating assistance, time is always of the essence because the seasons come and go, and we want to make sure that we are using these funds in a way that they are designed for. So that's the bill. Happy to answer any questions that you may have.
Thank you, Delegate Hernandez. Any questions from our committee? Delegate Walker, I see you pressing.
Thank you. You're good. Put the wrong button here.
Now I can hear you.
So we're talking about a 12-month subsidy there. Okay. And when, I guess the question would be, when is the most energy needs for individuals like this? I mean, certainly we have 4 seasons here, and we can understand winter months are very critical.
Yeah, I think that's right. We do have 4 seasons in Metro. I would say that's part of the reason why it should be opened year-round. I think the agency has done the best it could with the existing window that it has. There are 2 distinct pots of money, heating versus cooling, and I think the Deputy Commissioner of DSS may be in the room if you want to come and speak to that as well. We work together on this legislation.
Thank you.
Good afternoon, sir.
Good afternoon, Madam Chair and Delegate Walker. Just specifically to your question is that this program, differently from like a SNAP benefit or a Medicaid benefit, is it's not a monthly benefit. So it's a one-time benefit. So if you get heating assistance, you get a one-time benefit per year, or you get a cooling assistance, you get the one-time benefit, which is very different from the other populations that we serve. And so the reason that there has not been a 12-month window is because it's a limited pot of money. And so that limited pot of money has to be put out in one-time installment instead of a monthly agreement like we do for the rest of them. So it's handled a little differently from that piece of it. And so the bill is trying to give the applicants that may need it is you're not really thinking about heating your house in August when it's 100 degrees outside. And by the time you are thinking about heating your house in November, the application window is already closed. So it's trying to fix that. And trying to move the regulatory process forward, we already have a regulation in place. But as you all are all too painfully aware, is that regulatory process takes a little while to get there. So he's trying to move us more quickly to get it completed.
Thank you for the explanation.
Thank you. Delegate Orrock.
And Mr. Ayers, before you leave, am I correct also right now, as individuals come to you and their circumstances might have changed during the course of the year, if they're not in that window, they just have to wait till the next year. And this would allow y'all to address the needs as they come forward, as their housing circumstances change. It just gets a lot more fluidity, but it's still just an allocation of federal flow-through dollars, so it has no true state budget impact, correct?
That's correct. Madam Chair, Delegate Orrick, you are correct.
Thank you for those clarifications. Are there any other questions from our committee? Any folks here in the audience who wish to speak in support of House Bill 855? Thank you so much for being here. Please keep your comments brief so we can hear from everyone. Go ahead.
Madam Chair, Morgan Whalen with Virginia Natural Gas, with appreciation to the delegate, really supportive of this legislation. As the delegate mentioned, our customers where they experience their highest heating costs are often in December, January, February, March, but the application window has already closed. And this was brought to our attention. We have sister companies in other states. Tennessee is year-round, Georgia's until funds are exhausted. So in our review, Virginia has one of the shortest sign-up periods in the country. And so we think this is a great change to help Virginians throughout the Commonwealth. So thank you again.
Thank you. Good afternoon.
Hi, Madam Chair, members of the subcommittee, Amanda Cox with Appalachian Power. We support the bill. LIHEAP has provided critical assistance for our customers in times of need, and we really appreciate the delegate bringing this forward.
Thank you so much. Good afternoon.
Good afternoon, Madam Chair. Scott McGarry, Washington Gas. Also very much hoping that you'll recommend this favorably. I've been working on this since 2006 when I met with Marilyn Tavenner, who was Governor Kane's Secretary of HHS. Your action moving this forward will also complement other legislation with respect to disconnection of services and help Virginia retrieve, I hope, some of the $12 million we've had to turn back because the application period is so short. Thanks very much.
Thank you.
Good afternoon, Madam Chair. Heidi Cook on behalf of Columbia Gas of Virginia, and we also support the bill and thank the delegate for bringing it forward. Thank you.
Thank you so much. Good afternoon.
Madam Chair, members of this committee, Dana Wiggins with the Virginia Poverty Law Center. We thank the delegate for bringing the bill and working with us on this issue. I think he said it right. It is heartbreaking. We run a utility helpline where we talk to people who are struggling with their utilities across the Commonwealth for every type of utility. And honestly, my colleague Kaja is the one who has to answer the calls. And it is, we hear horrible stories every time of people who just missed the window and then they are not eligible for any of those funds for the rest of the heating season, which for many people means that they are really at risk of disconnection over and over again. So we are thankful for this and not leaving any of those federal dollars on the table. We want to make sure that we actually get to use them and put them to work for Virginians. Thank you.
Thank you. Is there anybody here to speak in opposition to House Bill 855? All right. Members of the committee, this bill is before us.
Madam Chair, does this have to go to appropriations?
No, we do not have it. It is not listed. And I think the substitute also changed the FIS situation too.
Then I move to report.
Second.
We have a motion that's been properly seconded to report House Bill 855. Madam Clerk, if you can please open the roll. Members of the committee, please vote. Please close the roll. House Bill 855 has been recommended to report with substitute. Thank you so much, Madam Clerk. Congratulations, Delegate Hernandez.
Thanks for your time.
Thank you. I have Delegate Cole.
Good afternoon, Madam Chair, members of the committee.
Delegate Cole, I think you are here about House Bill 13. Oh, you have two. Okay, go ahead.
Yeah, so the first one is, give me a second, I'm looking at my 1318.
18. Okay, so before we take action on that, Delegate Wiltz, I believe House Bill 1282 is a mirror of that one. Am I remember? Yes, they're identical. As such, I'd like to I would entertain a motion to incorporate Delegate Wilt's 1282 into Delegate Cole's 1318, and we did make that suggestion to his office earlier, since they are identical.
So moved.
All those in favor of incorporation, please say aye. Any opposed? Great. Please continue, Delegate Cole.
Thank you so much, Madam Chair. This bill is aimed at improving our state's Medicaid waiver program, specifically the 1915C Home and Community-Based Services Medicaid waivers. If you recall, during COVID-19 time, we allowed families who were receiving these Medicaid waivers to utilize the funds to pay themselves to take care of their family members during the pandemic. This bill just simply makes sure that that is now the norm. I believe the program comes to an end in March, if I'm not mistaken, but this just continues the program and makes it the norm here in Virginia. There are a few other states that already do this. And as someone who is watching my mother take care of my grandmother right now, one thing is for sure, we all believe no one is going to take care of our family members like ourselves. And so there are people who, as I was knocking on doors campaigning, that raised this issue to me. Even after we won, there were people who raised this issue to me. There was a particular mother who shared her story with me that she has 2 sons on the autism spectrum, and she stated that one is totally nonverbal. She also expressed to me that some of these citizens experience sexual abuse, mental abuse, physical abuse, and she expressed to me if her child is totally nonverbal, how would she ever know that her son was being taken advantage of? And so we just want to simply continue out this tradition. You know, when we were told a couple years ago things could not be done, then the pandemic hit and we found out a lot of things could be done. And so we just want to continue this effort, and I would hope it would be the privilege of this committee to pass on the full committee.
Great. Thank you so much, Delegate Cole. Are there any questions from our committee members? Delegate Srinivasan.
Thank you, Madam Chair. Question for Delegate Cole. So this bill directs DMAS to ask or to work with CMS to develop the plan for a state plan amendment to go before CMS. Am I correct, Delegate?
That is correct. Yes, sir.
Thank you.
Thank you. Are there any other questions from our committee?
Madam
All right.
Chair,
We'll
Chair.
oh, sorry, Delegate Sickles.
Madam Chair, maybe you've discussed this, but HB 909, Delegate Shin's bill, covers many of these same things, and maybe these bills, it's a little bit broader than this.
That's right, Delegate Sickles, and we had discussed that, but we felt that the combination of 1318 and 1282, they have very minimal or no FIS, and so we wanted to make sure that those were able to move forward, and while the broader bill still has a FIS and is considered, we wanted these changes to be able to move forward.
Okay.
Thank you.
So Madam Chair,
Delegate Auroch.
Madam Chairman, to that end, and I appreciate the Uber chair raising the point because that was a concern I had as well. Might we be in a better posture, kind of directing it to the Uber chair, we'll let both of them go forward, but both go to approps. In the event that approps can't find the money for Delegate Shin's bill, then this one could come back out and not put 2 competing bills on the floor, one broader and one narrower in scope.
Delegate Auroch, I think what the committee is trying to do here is saying that these 2 don't have a FIS, they wouldn't need to go to appropriations at all. And we can, I think if we were to pass Delegate Shin's bill on appropriations, these 2 would be superfluous, but I guess there's no harm done because it covers the same material. So I guess there's no harm in reporting this bill out.
All right, so we were about to have public testimony. If there are folks who are here to testify in support of this bill, please line up.
Good evening, thank you. My name is John Segal. I'm a parent of a special needs child. I'm actually the lady that Mr. Cole was, or Delegate Cole was speaking of, is my better half, who met with him and really brought this to the attention. But yeah, I just really want to say thank you for those that have brought these bills together from a parent in this situation. All we're really looking for is a reasonable pragmatic system that we can work with that preserves the protection of the child, where when able, the parent can be the primary caregiver, but also just balancing it out with managing risk and being there so that we can still get some in-home help when we need it for the mental health of the household also. I think you'll see that mental health is a major challenge in special needs households, and we really rely on these systems for both the recipient and what's best for them and the household altogether. So fully support this bill. Thank you, sir. Thank you, others, for driving this, and I'll leave it at that. Thank you.
Thank you so much. Is there anybody else here to speak in support? Oh, there we go. Good afternoon.
Hi, yes, I'm Tanya Milling, Executive Director at the ARC of Virginia. We very much support this bill. I think we want to kind of underscore that no other place in our society do we not assume that parents are the best for their children. And so we don't know why that would be different in the cases where particularly these children have extraordinary care. So we thank the delegate and very much support. Thank you.
Thank you so much. Good afternoon. Please come on up.
Thank you. My name is Donald Benson. I just recently adopted a 4-year-old daughter who, because of the abuse of her father, is now severely traumatized and severely affected and will be affected for the rest of her life. And to have this bill come through would be amazing for us because it would give us the opportunity to make the decision. Like has been mentioned, no other place, DSS, any other agency, assumes that the parent is the last resort rather than the first. So I fully support this bill and appreciate your consideration.
Great, thank you so much. I think this bill has some good energy moving forward. So if there are other folks who'd like to speak in support of this bill, please come forward and please keep your remarks brief so we can hear from everybody. Thank you.
Good morning, Madam Chair, members of the committee. Ashley Wright on behalf of Karen Defelsky and the Virginia Access, and we support the bill.
Great, thank you so much. Good afternoon.
Good afternoon, Madam Chair, members of the committee. Terry Morgan with the Virginia Board for People with Disabilities. We support this bill. We think it's going to have a positive impact on families and a positive impact on children.
Thank you. Good afternoon.
Good afternoon. Madam Chair, members of the subcommittee, Victor McKenzie, Executive Director of Sarah, Virginia, and we support this bill.
Thank you so much. Good afternoon.
Madam Chair, members of the subcommittee, Ann Flippen, Executive Director of the Autism Society of Central Virginia, and we strongly support this bill.
Great. Thank you. Is there anybody else in the room? All right. Is there anybody in the room to speak in opposition to this bill? Okay, I think we do have somebody online who signed up to speak against House Bill 1318. Marcia, would you like to provide some testimony?
I would. Thank you very much. I'm Marcy Tedderton. I'm with the Virginia Association for Home Care and Hospice. We do oppose the bill. Over the past 30 years, we've seen many changes in home and community-based waiver programs. Virginia has taken steps over the years to modernize these programs. Modernization does not mean that we remove all the guardrails from our programs, nor would it be safe. While I understand, and you have heard testimony this evening from some really great parents that don't need to have guardrails in place, there are many parents and family members that need even more guardrails. And that's the purpose of regulation and statute, to protect those that cannot protect themselves. The consumer-directed model of care has changed, as I said, over the years. Originally, it was intended to be the best option for individuals with significant physical disabilities that could advocate for themselves. We've seen that change. Nonetheless, we believe that there need to be guardrails in this program. All one needs to do is look at last quarter's report from the Attorney General's Medicaid Fraud Unit to see what egregious things happen in the consumer-directed model of care and the fraud, abuse, and neglect that occurs. And I won't go into any specific cases. The information's out there. You can review it for yourself. There is a need to have guardrails, and we would ask you to please keep guardrails in place. As an option, we would recommend that parents work with agency-directed care so that RNs could do supervisory visits to ensure that there is no abuse and the children are taken care of correctly. Thank you very much.
Great. Thank you so much
And
thank you so much
and
for
those
your
are my
testimony.
yes, those are my general comments for all three of the bills.
Great. Thank you. We'll take note of that then. Thank you so much. Members of the committee, House Bill 1318 as incorporated is with us.
Madam Chair, I move to report as amended. Or as substitute.
Okay, a substitute, Madam Clerk reminds me because it's been incorporated.
I move to report as a substitute.
Second.
Okay, we have a motion to report House Bill 1318 as substituted. That's been properly seconded. Madam Clerk, if you can open the roll. All right, everybody who's voted has had an opportunity to, and House Bill 1318 has been recommended to report with substitute. Delegate Cole, I think you have one more bill with us.
One more bill, yes. HB 1423. This is fairly simple. I will explain it and get out of your way. HB 1423 directs the Department of Medical Assistance Services to annually publish on its website the average hourly payment rates for home care services for each type of service provided. The bill also requires the department to publish the total number of Medicaid paid home care claims and the number of Medicaid enrollees who received home care services in the prior year. This is just simply a transparency bill. I don't have to repeat the facts. We've already know that our families are in immediate care crisis. There is not only an economic justice issue, it's also many different issues that are being faced in families that are trying to take care of themselves and their family members. And we just want to make sure that the intent of this legislation is to fix and ensure that the public funding Medicaid money is going to the care and not to the profits. And so I just hope it'll be the will of this committee to report it to full committee.
Great, thank you so much. Delegate Orrock.
Yeah, Madam Chair, questions of the patron.
Yes, Delegate.
Delegate Cole, I think I understand what you're trying to get to, but I question the full complexity of what you're asking the department to come up with. And I'll just share personal experiences. Become the primary caregiver for a sister of mine with dementia. And as we were going down this road, we found there in the Caroline, Spotsylvania area, there are about 8 or 10 different providers, all with different rates. Those rates vary depending on whether it's weekend, depending on the number of hours they are working on a given monthly basis, given whether it's a holiday. And also they vary because of the level of the provider expertise, while they may be certified at the same level. And so I guess with all that as a preface to the question, how will the department be able to gather all this information? I don't know of anything right now that requires those businesses to report to the department or elsewhere what they are. And even once they do, how does this become something the consumer can actually benefit from when it's all just based on dollars and nothing about quality?
Yeah, thank you so much for that question, Madam Chair, Delegate Orrock. We have been talking with DMAS, and they have also informed my staff that they're currently in the process of developing a dashboard to share data that this is going to be covered in this bill. And so they're working on the dashboard. It's going to be launched in the future. We just want to make sure that this is codified into state code.
Great. Thank you. Delegate Cole, I see Mr. Frank from DMAS here if he wants to talk about those efforts for the dashboard.
Madam Chair, Will Frank with DMAS. We communicated with the delegates office today. The dashboard is up. It's actually live. It just hasn't been advertised yet. So we already actually are doing this at the moment.
Madam Chair.
Delegate Orrock.
So tell me about all the complexity then that I've dealt with and how y'all have been able to address that on your current dashboard.
So this has been kind of a work in progress for DMAS over, Madam Chair, sorry. This has been a work in progress. So we've been trying to put this together. Again, we haven't advertised this at this point, but happy to send around the link to the dashboard so everybody can take a look at it and see what kind of information we're putting on that.
Madam Chair.
Delegate Shin.
Would Mr. Frank just quickly be able to tell us the URL for it so I can pull it up real quickly?
I can. I gotta find the link. Excuse me, sorry.
While he's pulling up that link, are there any other questions for the patron? Okay, we'll wait for Mr. Frank.
So I have the link. It's kind of a long address. I'm happy to read it out to you. It's www.dmas.virginia.gov /data/waiver waiver-services.
Waiver-services. Thank you.
Madam Chair, if I may, I just want to state that while this is the dashboard is up and live, we just want to make sure again that this is codified in the code. Administrations can change, people may change their minds, but we just want to make sure that this is out and it's in the public. It's just merely a government transparency bill.
Right. Thank you so much. Are there any folks in the audience who would like to speak in favor of this bill? Oh, here comes somebody. Good afternoon.
Afternoon, Michael Sizemore, Advocacy Manager for Sarah of Virginia, and we support this.
Great. Thank you so much. Is there anybody in the audience who wishes to speak in opposition to this bill? Okay. Earlier, I think, sorry, just lost my train of thought. 1423. Marcy Tedderton, you had signed up to speak against, and I know you had made public comments to the last bill and said they applied to all kind of similarly to these bills. Do you have kind of new comments that you'd like to provide to House Bill 1423?
I do, Madam Chair. Marcy Tedderton again with the Virginia Association for Home Care and Hospice. We've reviewed the proposed legislation and we see it as redundant to other things that are already happening with Medicaid. All Medicaid rates, and Delegate Orrock, the way we read the bill, this only applies to Medicaid. It does not apply to private duty care, and most likely you were paying for private duty care for your loved one. All Medicaid payment rates for services are established by the General Assembly. These rates are currently posted and have always been posted on the DMAS website. I will admit they're not necessarily easy to find at times. They have in the past published rates and geographical information on types and amounts of Medicaid home care services, including agency and consumer directed. In fact, they have included a dashboard, like's been discussed, for all lines of Medicaid services. As we transition to CCC Plus and now Cardinal Care, the publication format did change, and that's because the data collection sources changed. Nonetheless, this information is currently available through Medicaid and is on their website. It's important for you to note, and we would like to recognize Director Roberts at DMAS for her leadership. She has been publishing and republishing information in a much more user-friendly format for providers and consumers, not just information on home care. We believe it's really inappropriate to just single out home care to this. If you're going to put this in statute, you shouldn't just single out one particular provider group. It should be an all or nothing proposition. Thank you very much.
Thank you, Ms. Marcy. Appreciate your testimony. Okay, so this bill is now back in front of the committee, House Bill 1423. Committee members.
Madam Chairman.
Delegate Orrock.
Madam Chairman, just speaking to the measure, for today I'm going to be voting no, but I would like to work with the patron before we get to full committee to put in language, because my real concern, sounds like the department's already doing this. But if we pass this bill today, then this is what they're locked into having to do. And I want to find some language where that it ensures this information will be available as appropriate, but give them flexibility as we go down the road to include other data as well. So for today, I'm going to be a red, but I hope to be a green by the time we get to full committee.
I'm looking forward to it.
Great, thank you. Committee operates by motion.
Move to report.
Second.
Okay, so we have a motion that's been properly seconded to report House Bill 1423. Madam Clerk, please open the roll, and committee members, please vote. All right, please close the roll. The committee recommends reporting House Bill 1423 by a vote of 6-2. Delegate Cole, thank you so much.
Thank you, Madam Chair.
We have members in the room who are hoping to be in multiple places at once. And so I know that we've had members who are waiting, but I'm going to call on Delegate Price so she can go back to her other committee.
Thank you, and Madam Chair and members, I will be quick. I know that this committee has done and continues to do great work for those that are seeking benefits, and one of the issues that we are finding exists is hygiene insecurity, and I found this issue very tangible when working with summer camp in our schools in Newport News, and some of the students were discussing hygiene as a reason for their chronic absenteeism in our schools. So when families don't have what they need to wash clothes or for brushing teeth or bathing, children face bullying and are being ostracized at their schools, and they either end up skipping school or suffering while at school and not being able to thrive in their classes. So to be clear, currently these families that receive benefits are unable to purchase, to use their benefits towards diapers, baby wipes, fluoride toothpaste and toothbrushes, dental floss, body wash and soap, shampoo and conditioner, deodorant, feminine hygiene products, sunscreen, and toilet paper, all things people need to be healthy. But I do recognize what the fiscal impact statement was expressing as the complexities on how this would be run. So I would ask that the subcommittee would carry over House Bill 620 so that we can continue to work and look into ways where families and our young residents would be able to access hygiene items so that we can keep them happier and healthier and less likely to miss school, and emphasis on healthy and happy.
Great, thank you so much. Delegate Price would like to carry over her bill.
Madam Chair, I'd move to carry over House Bill 620 into 2025 session.
Second.
All those in favor of carrying over House Bill 620 into the next year's session, please say aye. Any opposed? Great, thank you so much for bringing this to our attention, Delegate Price. Delegate Carlson. Good afternoon.
Good afternoon, Madam Chair and members of the subcommittee. You have before you House Bill 453 relating to barrier crimes for kinship foster care placements. I'm sure you guys are aware, kinship care is a beneficial tool in the foster care system. It builds on familial and communal ties and is shown to result in better stability for children and increased permanency outcomes. Unfortunately, our pool of potential fictive kin and kinship placements in Virginia is quite limited. Virginia's stringent barrier crime requirements are often inhibit kin placements. And in fact, Virginia statistics bear that out. Only 14% of children in foster care in Virginia are placed with relatives. That is a far cry from the national average of 35%. This bill, as before you, is a targeted and measured approach. I'd like to say a scalpel approach to safely expand the pool of eligible kinship foster placements. I'm going to go into detail about the bill just so I can hopefully cut off some questions about it. I have not asked to reduce the standards for stranger foster care. There is a distinction between people who actively seek out becoming foster care placements for children that are not their own. These are kinship placements. It is when a child, so for example, if I wanted to volunteer to be a foster parent versus if my brother was struggling and I needed to take in my nephew. So this is when DSS is reaching out to these kinship placements. I am asking to reduce that substance possession, which is currently a barrier crime, for 10 years. I'm asking to reduce that to 5 years. That's supported by research. I'm also asking to remove from the barrier crime list misdemeanor offenses under 18.2-57 or 18.2-57.2 if 5 years have elapsed since the crime was committed and the crime does not involve abuse, neglect, or moral turpitude of a minor. All of those were identified, by the way, based on a survey that DSS did that identified it. I think they surveyed, I want to say 71 DSS agencies responded, or child placing agencies, and those were the top 3 things that were identified as being barriers to placement. All of these requirements, I will just say, all of these keep in the requirement that DSS make a specific finding that the placement would not adversely affect the safety or well-being of the child. And then furthermore, I would just emphasize that these are foster care placements, so there are a ton of guardrails in place. These are children that have a guardian ad litem appointed, that have regular court intervention, that have monthly meetings, and that are being provided services to check on their safety at regular intervals. So I've spoken a lot, probably more than I have all day, on the bill that I know the most about. But I did work on this in conjunction with the UVA Law Clinic, and I do want to make sure that I give credit to Divya Sharma. And if you guys are willing to extend another minute, I would like for her to make comments on it as well.
Thank you so much, Divya. Welcome.
Good afternoon, Madam Chair and members of the committee. My name is Divya Sharma, and I'm a student in the State and Local Government Policy Clinic at UVA Law. The views I expressed today are my own. I've been working with Delegate Collison to develop this legislation, and I'm here today to ask that you vote for HB 453. Today, a significant number of potential kinship care providers are ineligible due to Virginia's stringent barrier crime requirements, even when the barrier crime took place years before and the safety of the placement is not in question. These restrictions frequently prevent social services organizations from placing children with kin and make it more likely that these children will have to enter non-relative foster care placement instead. Together with Delegate Colson's HB 27, which this subcommittee has already unanimously supported, this bill will strengthen Virginia's use of kinship providers and improve our foster care system. For these reasons and those given by Delegate Colson, I strongly urge that you vote for HB 453. Thank you.
Thank you so much. Are there any questions about House Bill 453 from committee members? Are there any folks who are here to speak in support of this bill? Good afternoon.
Afternoon again. This is Michael Sizemore with Sarah of Virginia. We have nothing to add with what the delegate has said other than our overwhelming endorsement for the passage. Thank you.
Thank you so much. Good afternoon.
Good afternoon, Madam Chair. Valerie LaRue from the Virginia Poverty Law Center at the Center for Family Advocacy. We have been supporting similar bills to Delegate Colson's for years. The General Assembly has done multiple studies for years on this issue. The federal government has been advising states to make it easier for relatives to be approved as foster placements. And so for all those reasons, we support this bill. I'm also speaking on behalf of the Foster Care Policy Network run by Voices for Virginia's Children, and they support it as well. Thank you.
Thank you so much. Good afternoon.
Good afternoon, Madam Chairman, members of the committee. Becky Bowers-Lanier, and I work with a group of advocacy organizations that have been focusing on recovery and barrier crimes, and we are totally in support of this measure.
Thank you so much. Is there anybody here to speak in opposition to House Bill 453? All right, members of the committee, the bill's in front of us.
Madam Chair, move to report.
Second.
Okay, House Bill 453 has been properly moved and seconded. I don't think I said that quite right this afternoon. As there's motion's been moved to report and properly been seconded. House Bill 453, please open the roll. It is a long day. Delegate Colson, we recommend reporting House Bill 453 by a vote of 8-0. Congratulations and thank you so much.
Thank you.
I'm going to call on Delegate Cohen, who is here.
Thank you so much. And I have a substitute. Of course, I don't have enough copies for all of you.
I'd like to make sure we give one hard copy to our friend Delegate Orrock. He is the hard copy, the old school paper.
I know how to use my iPad.
Thank you so much. My apologies for the last minute change. I'd first like to ask that the committee accept the substitute.
Madam Chairman.
Delegate Orrock.
Would it be correct? The primary difference is bringing in the necessary HIPAA language to make sure we're in compliance with federal provisions.
That is the primary change, adding an and a but, and striking consumer training has been, and striking consumer directed in line 19. The other change that we just finagled in the hall, I have a new understanding of what peace in the valley means, is that we, on line 17, 18, my apologies, where it says, let's see.
Abbreviated once per quarter.
Once per quarter is the change. Sorry, I realize I have the 4 versions previous. That was the 3 o'clock version.
The adoption substitute.
Second. The substitute has been moved to be adopted. All those in favor say aye. Aye. Any opposed? Wonderful. The substitute is properly before us. Delegate Cohen, please tell us what your substitute does overall.
The substitute is, I'm very grateful for DMAS and everybody there who came in and helped me tweak this language to make sure that video we were referencing was HIPAA compliant, as Delegate Orrock mentioned, and that we were making sure to include more programs. So we were adding periodic screening, diagnostic, and treatment, so EPSDT programs, as well as Medicaid Works. So we were just making it a bit more inclusive in the groups that it represented.
Members of the committee, are there any questions about House Bill 499? Okay. Are there any folks in the room who'd like to come and speak in favor of this bill?
I'm sorry, Chair Tran. I was just addressing the changes in the substitute.
Oh, I'm so sorry. I thought we had done that previously. Please discuss your underlying bill.
My apologies. This bill gives our families on family and individual support waivers, community living waivers, CCC plus waivers, as well as the Medicaid Works and early and periodic screening diagnostic treatment programs, the opportunity to conduct routine visits via a HIPAA-compliant video connection. This was done very successfully during the COVID state of emergency and provided a much smoother delivery of services. As in every area of health-related employment after the state of emergency ended, the number of service facilitators has not bounced back to pre-pandemic levels, leaving families with cancellations and rescheduling and who are experiencing a high degree of frustration, also meaning that they are prone to miss work, doctor's appointments, et cetera. If families opt for this video option, and again, this is just presenting another tool in the toolkit, they may request face-to-face in-person visits at any time. In addition, quarterly, they'd be required to have an in-person visit just so somebody is putting physical eyes on making sure that everybody is in perfect shape. Again, I really appreciate DMAS working with me on this. It's definitely been a collaborative experience. I am so grateful to my constituents for bringing this issue to my attention and hope we can help make their lives a little bit easier for allowing this option. I know there are several folks who would like to testify for this bill.
Thank you so much, Delegate Cohen. Now, members of the committee, are there any questions? Great. Members of the public in the room who would like to speak in favor of this bill, please line up. Oh, yeah, folks online. We do have folks online. Okay. Or is there anybody in the room to speak in opposition to the bill? And then we'll go to the folks online. All right. We will go to our folks online for House Bill 499. And we have two folks. I'll start with Lucy Beednall.
This is Lucy Beednall from the Arc of Northern Virginia. We have enjoyed working with Delegate Cohen on this bill. As she referenced, during the pandemic, families were for the first time given flexibility to have some virtual visits. And for families who are already meeting with waiver care coordinators and service support coordinators, it provided a little bit of relief from one more meeting that had to be scheduled in person, often during times that the child with a disability was there and there was a whole lot going on. So it gave a nice balance of oversight and contact without an additional burden on the family. And as Delegate Cohen noted, we have seen real drops in the ability to recruit people to the workforce in service facilitation and the ability for those people staying in the field to meet with families virtually, meant fewer cancellations and more service consistency for families while still providing necessary oversight. We strongly support the bill.
Thank you so much. And next we have Ms. Rachna Sizemore-Heiser.
Hi, can you guys hear me? For some reason, my camera doesn't seem to be turning on. My apologies. I don't know why.
We can hear you just fine. Thank you.
Thank you. Thank you for letting me testify. I was one of the constituents that brought this bill to Ms. Cohen. I can tell you I have personal experience. My child is one of the ones receiving consumer-directed services on this waiver. And the virtual visits worked very well during the pandemic. We had a consistent service provider who was able to give us resources and really get to know my child and really help support us. After the pandemic, I will say we've had turnover after turnover. We've had inability for scheduling. So I've had to take time off work, change doctor's appointments. We get somebody emailing us the night before saying, I need to be there tomorrow morning. And there's no flexibility. If I say, I've got a meeting, can we do it the next day? No flexibility. I don't blame the service providers. There is just such turnover that there's really been very little support. And we'll sit sometimes for hours waiting for somebody to show up and they won't show up. And then if we can't reschedule on their time frame, we get threatened with loss of services. Again, I don't blame the service providers. They are doing their best, but the quality of care between during the pandemic to now has been significant. We had to scramble to return early for Thanksgiving vacation because of the lack of flexibility on these service visits. It is a real challenge for families who are already challenged. So thank you for considering it.
Thank you so much. All right. Members of this committee, House Bill 499 is before us.
Madam Chair, I move to report with substitute.
Report with substitute, and we did get a letter on this one, so it has to be referred as well.
I move to report and refer to appropriations with substitute.
Second.
All right, so we have a motion that's been properly seconded to report and refer the substitute to appropriations. Madam Clerk, please open the roll. Great. Thank you so much. Please close the roll. That recommendation has been made by a vote of 8-0. Delegate Cohen, thank you so much.
Thank you, Madam Chair, members of the committee.
Delegate Runyon, I believe you were next.
Thank you, Madam Chair, members of the committee. I have a pretty straightforward bill. Slot retention requests, developmental disability waivers, adjustment of the sunset date. I do have an amendment to request report. Does staff have the amendment?
All right. Would you like counsel to report out the amendment?
Please.
All right, counsel, please report the amendment.
Madam Chair, there's one amendment on line 14 introduced after period of, insert up to. And yeah, up to, that's it.
Can we get a motion on the amendment?
Second.
All those in favor of reporting the amendment, please say aye. Aye. Any opposed? All right, the amendment is now properly before us. Delegate Runyon, please tell us about your bill as amended.
Thank you. This bill, both the original bill and the amendment, just offers additional flexibility. It increases the original waiting period or sunset period from 30 days to up to 365 days, because not everybody needs the full 365. In working with DMAS on this was a request that they did. ARC of Virginia and I have been working on this bill for a couple of months, and they certainly are in agreement, and pretty straightforward to provide some of the most vulnerable of our citizens the opportunity to utilize services available. Happy to answer any questions. We do have folks from both the ARC and DMAS here available if there are questions.
Great, thank you so much. Members of the committee, do you have any questions? All right, I don't see any. Members in the public, is there anybody here to testify in support of the bill?
Not to scare you. Hi, Tanya Milling, the ARC of Virginia. Thank you so much to the delegate for bringing this forward. Really part of a comprehensive plan. We're very excited that 3,440 waivers are probably, hopefully, coming our way. This is going to allow time for capacity to build. Right now, there are 190 families that have reached that 150 days. We want to make sure that we can have folks hold on to that while the other focus areas that are really about building capacity has a chance to work. So we very much support this bill. Thank you.
Thank you so much. Good afternoon.
Hi, my name is Brian Kelmar. I'm a parent advocate, and for my son who has the waiver, we appreciate Delegate Runyon bringing this up, and we support this bill.
Thank you so much. Good afternoon.
Good afternoon. Terry Morgan with the Virginia Board for People with Disabilities, and we support this bill. Thank you.
Good afternoon.
Ariel McAloon with Fairfax County, and for many of the reasons stated, we support the bill.
Great, thank you. Good afternoon.
Good afternoon. Ann Flippen, Executive Director of the Autism Society of Central Virginia, and we strongly support this bill.
Wonderful. Thank you so much. Good afternoon.
Good afternoon, Madam Chair, members of the committee. My name is Jennifer Faison. I'm here representing the Virginia Association of Community Services Boards, and we support this bill.
Thank you. All right, I don't see anybody else coming forward. Is there anybody here who would like to speak in opposition to this bill? All right, members of the committee, this bill did not get one of those letters, so it can just be reported if you'd like.
Madam Chair, I move to report as amended.
As amended.
Second.
We have a motion to report as amended that's been properly seconded. Oh, Delegate Sickles, my Uber chairman.
Speaking to the motion, I just want to make a comment that since DMAS did not say anything, I'm assuming they approve of this bill. So just wanted to make that point.
Is Mr. Frank still here? Oh, no, somebody new. All right.
Good afternoon, Madam Chair, members of the Subcommittee. Jeff Lenardi with Department of Medical Assistance Services. We worked with the patron on the minor amendment that he put. The administration has no official position on the bill, but we have no problems with it as written.
Great, thank you. We were on a roll, sir. So
Thank you, Madam Chair.
we have such good bipartisan support so far for helping this community. So we have a motion that's been properly seconded to report House Bill 577 as amended. Please open the roll, Madam Clerk. All those here, please vote. Please close the roll. House Bill 577 has been recommended to report as amended by a vote of 8-0. Thank you so much, Delegate Runyon. Yay. Okay, as Delegate Wilt comes up, I just want to say that by the request of Delegate Watts, the patron for House Bill 127, we are going to strike. She's asked that we strike that bill.
So moved.
Second.
If we can pull that vote up. Please vote, members. Please close the roll, and we have stricken House Bill 127 by vote of 8-0. My grammar too. Delegate Wilt. And I think when you were out of the room earlier and we had talked to your office, we had incorporated your bill, House Bill 1282, which is exactly the same as House Bill 1318, and that one reported out. So you should know that. Yes. Okay, great.
Delegate, well, that was Delegate Cole's bill. That was identical, and so that got rolled in.
Yes, and we did that because those didn't have a FIS and didn't have to go to appropriations. We wanted to make sure that those changes made their way to the floor for a vote.
Thank you, Madam Chair.
And I think now you have House Bill 1021 with us.
That's correct. Madam Chair and committee members, this is a Section 1 bill that allows our local CSBs and ultimately the local waiver slot assignment committees to convert allocated community living waiver slots to both family and individual support waivers and building independence waivers when the community living waivers are not being utilized or not expected to be utilized for the foreseeable future. So that's kind of the underlying theme of the legislation. What we're discovering, what we know is some of the community living waivers. Those are our citizens that need the most help, and we have a portion of those that go unused. But we have need for the other waiver slots. And so what I'm simply trying to do is convert those, the community living waivers over to be used in the localities. Now, Madam Chair and committee, please understand that this in no way, if there's a need in that locality for CL waivers, then this doesn't apply. It's only if there's no use for them. That's kind of the nuts and the bolts of it, Madam Chair.
We have a line of questions now. Thank you so much, Delegate Wilt. I'll start with our Uber Chairman, Delegate Sickles.
Madam Chair, isn't there a substitute or a line amendment for this bill that was sought by the administration?
Delegate Wilt?
Yes, I do have.
I could speak to it if you don't.
Mr. Chair, please.
Yes, Mr. Chair.
Maybe council can speak to it, but the concern is that the flexibility be given to DBHDS and not to the CSBs. This bill is written to the CSBs, and Deputy Director Lenardi's here. Maybe he can speak to how that would not be efficient use of this. But he told me that there would have been a substitute or a line amendment offered to you, and I don't know if you were amenable to it. Do you have it?
Yes.
Okay. All right.
And I believe council has as well.
Great. Council, could you please report the amendment?
Yes, Madam Chair. I'd be happy to speak to the substitute and what it does. So it does clarify that DBHDS does not have this authority to change these waivers. It's specific to DMAS, and it also adds a provision about the CSBs being able to relinquish their control of waivers back to DMAS, and the DMAS can then distribute those waivers to other CSBs that need them. So in cases of CSBs that have excess waivers versus CSBs that have not enough, they can be moved through DMAS. I think that captures.
Madam Chair, ask a question.
Madam Chair, I'd say I am amenable to the amendment. Whatever gets us there.
Okay. Okay. So what? Amenable and open to the conversation. Can Delegate Shin, do you have a question on the amendment that was proffered?
I was just going to hope to ask council here. Does the current authority to allocate waivers to CSBs live with DMAS?
Madam Chair, Delegate Shin, I believe my understanding is that in order for CSBs to transfer this, they don't have the authority to unilaterally transfer these waivers. I think Jeff might be here to help me out. But
yes, Mr.
Madam Chair,
Lombardi.
members of the subcommittee. So these are three separate waivers that DMAS has with CMS, our federal authority. And each of those waivers has a number of slots. And so we have to get a change in the number of slots approved by CMS. So by giving anyone unilateral authority to do that, it would not allow us to make sure that we have appropriate federal authority to implement it.
I see.
Okay. Thank you for that explanation. I believe, so we have these amendments that have been proffered. It would be nice if somebody could motion them so that we could have them officially before us and look at them.
Second.
All those in favor, please say aye. Aye. Okay, any opposed? All right, so the amendments are now officially before us and they will appear online in a heartbeat. They're already available if you want to check them out. As our committee members are pulling them up, if there's anybody with initial questions, I'll just take testimony from the public, and we can always come back to questions. Are there any folks here who would like to speak in support of House Bill 1021? Good afternoon again.
Hi, yes, Tanya with the Arc of Virginia. Tanya Milling, I'm sorry. Our real key here is making sure that we have the ability, and the departments have the ability to deploy these slots to people when they need it, right? We don't typically get such a large amount. So we want to make sure that the processes are there for them to be able to do that. We appreciate that amendment because we recognize that that's technically the way it needs to be. We really looked at two components. One being the conversion of slots. The second thing that's not here right now that we would be very interested in the conversation about is where DBHDS has the ability to move slots among the CSBs, not the CSB's authority, but the DBHDS have the authority to do that after 30 days. So if slots go into an area and they don't have anyone who needs a CL waiver, or they receive 10 CLs and they only have 5 people. So then it's just sitting there. Right now, DBHDS has the authority to make the change after 90 days. With this influx that we have, we feel like at 30 days is when they need to be able to make that assessment so that this big investment that we're making actually gets to the people that need it. Does that?
Thank you. I don't know if you've had a chance to see, I think this turned up to be a substitute. It doesn't discuss 90 or 30 days. So is that an additional change that you are seeking, or do you think the substitute addresses that timeline concern?
It's an additional thought that we have that we would love to have brought in.
Okay. I'm going to ask Uber Chairman Sickles has his hand up.
Thank you, Madam Chair. I think that what Ms. Milling would like to do would be ideal, but I don't think it may be legal because this is a program we share with the federal government, as Mr. Lombardi just said. Could we further amend your substitute, DMAS, so that we could do what she just said?
So I think, right, the question, Mr. Lenardi, is it possible for us to put a timeline by which the decision has to be made to kind of convert this to a different waiver, right?
And it's not convert that.
Or not convert.
To move from CSBs right now.
So to move, sorry.
At 90 days. We'd like to move it to 30.
Which is not necessarily in regulations.
I'm sorry, I was talking. What did you say?
Could you introduce yourself?
Does that mean that you, sorry.
So there is practice with DBHDS of doing the 90 days. That is not necessarily written in regulations, but rather a practice to keep those moving. I would need to check the amendments to see if that piece, but yes, we can put timelines in amendments.
Okay, I'm sorry, could you please introduce yourself for those who might not know?
I'm so sorry, Ann Bevan, Department of Medical Assistance Services.
Thank you so much, Ann.
I'm just going to introduce her.
Okay, okay. Okay. Delegate Orrock.
Yeah, Madam Chairman, I was just going to say, since there's no timeline written in here, would we, and not having the exact language of the substitute, but kind of working from the language of the original bill, if we said the board's discretion to expeditiously convert allocated community living waivers? Because I guess my thought being, is 30 the magic number? But leave it to the department to as expeditiously or efficiently or whatever, I don't know the best word, but to just make clear, we want them to be able to do this as quickly as practicable. And Mr. Uber, Chairman, Madam Chairman, if I may, we might want to let it go forward now with just a potential further tweak amendment at full committee, would be my suggestion.
Delegate Sickles?
Madam Chair, I think that might be a good idea because I think we might need this to implement the aggressive program that's before us in this budget. We're going to need the most flexibility. So if we could work on this language between now and full committee, it would be ideal.
Okay, and I do want to, I think we were having a sidebar because this bill is about allowing the conversion of one waiver to a different waiver, another waiver. And I think the issue that you were bringing up, Ms. Tanya, is a little bit different if it's from CSB to CSB. Correct. So I think what I'm hearing is that there is agreement to keep this bill as it is moving forward with some of these additional ideas because we recognize that flexibility is needed overall and a commitment that Delegate Wilt will continue to work on that language between now and full committee on Tuesday.
Yeah, Madam Chair, as amended.
As amended, yes. Correct. Continue working. All right.
Sure. Yes. Committee
members, as amended, and it did get one of those magical letters to go to appropriations.
I'd move to report as amended, or as substitute, sorry. Okay, so I'd move to report and refer as substitute to appropriations.
Second.
Right, so the motion's been made to report and refer the substitute to appropriations with the commitment to continue working to incorporate these additional ideas. Madam Clerk, please open the roll. All right, please close the roll, and unanimously by a vote of 8-0, we will recommend reporting, referring the substitute to appropriations, and continue working between now and Tuesday. Thank you, Delegate Wilt.
Committee for your consideration.
I think that Delegate Shin, you're up. Yay. Okay, we have House Bill 908 and 909. What would you like to take up first? All right, we have before us House Bill 908. Welcome back. Okay, so House Bill 908, and just for our committee members to know, if we act favorably on this bill, it does need to go to appropriations as well.
Okay, go ahead. Thank you, Madam Chair and members of the committee. You have House Bill 908 before you, which is has been a work in progress for us for a few years now. And it is a bill to direct the Department of Medical Assistance Services to amend the financial eligibility standards for certain waivers, providing services to individuals with developmental disabilities that Social Security disability insurance income is disregarded by the department when calculating such individuals' financial eligibility for such waivers. It sounds really complicated when you read the LIS summary, but actually it isn't quite as complicated because currently what's happening is disabled Virginians with a Medicaid-funded waiver to pay for group homes, community supports, and services to build their independence have a monthly income limit of no more than 300% of the maximum supplemental security income, or SSI, to maintain this waiver. Most waiver recipients begin their time on a waiver receiving only personal SSI, and if they are able, they can work and earn a modest amount of money while still staying well below the income cap for receiving their Medicaid waiver. As you might imagine, the opportunity to have a job that can have a meaningful impact on your life is both significant and substantial and really important for those living with disabilities. In 2019, Centers for Medicaid and Medicare Services, or CMS, granted new authority to states to decide how to count SSDI income specifically for waiver users. For so many years already, people with DD waivers have had to reduce working hours or quit their jobs entirely when parents retire or pass away, and then they become eligible for the SSDI. This year, 2024, is the first year ever that a parent passing away could leave enough SSDI and retirement benefits to the child that the child will immediately become ineligible for their waiver. This issue is expected to only become worse as wages increase and retirement ages increase, and it will become more and more pertinent for this body to solve this. For obvious reasons, this is an incredibly alarming and terrifying outcome for parents, especially as they do their own future family and financial planning. This plan costs, the proposed plan through House Bill 908, costs Virginia nothing, and we hope that it will in fact save the Commonwealth money over time as people will begin to pay, have greater copay amounts based on their SSDI income to stay in the waiver program. I have a number of advocates here in the room with me today who will probably be able to speak to this a lot better and share with you their own lived experiences with this challenge that we are trying to solve here.
Thank you so much, Delegate Shin. Do I have any questions from the committee to start with? All right. If you are here to speak in support of this bill, please line up. We also have, I believe, about a dozen folks who are online as well, and I want to give everybody an opportunity to share their stories, particularly because y'all have been waiting for a really long time. So I'm just going to implore you to please keep your comments brief to no more than a minute, and I am going to use the timer so that we could allow everybody some time to speak, okay? Thank you so much and welcome.
Good evening, Madam Chair and members of the subcommittee. I'm Ann Flippen, Executive Director of the Autism Society of Central Virginia, and I really appreciate the delegate for bringing this bill forward. We represent and support families from across the region on a daily basis to meet the complex needs of individuals with autism, and we strongly support this bill to protect Medicaid waiver recipients from losing their waiver due to SSDI income. I have several parents here with me tonight and other advocates to speak and support. Thank you.
Thank you, Anne. Thank you so much for coming this way, and please keep your comments brief. Go ahead.
Thank you. My name is Mark Williamson. I appreciate y'all hearing this. I live in Chesapeake, Virginia, practice law with the McGuire Woods firm in Norfolk. I have a 33-year-old autistic child, severely autistic, can't speak, functionally a 3-year-old. In addition to his autism, he has epilepsy and he has MS. This is all he's got. He's got a Medicaid waiver. He's had it for 25 years. If I die tomorrow, he loses it. If I live for 25 more years and you don't change this, he loses it. I cannot go through my retirement until the end of my life dealing with this issue. You guys have the power to fix this. This is not somebody who can work. This is somebody that will go off the system after 25 to 50 years of somebody who needs 24/7 care to take care of them. I just cannot believe somebody would allow this to happen. I hope you won't. Life can be unfair, but it shouldn't be cruel. Thank you. I have a statement that shows my Social Security record on the table. I sent it to you by email. There is no doubt that my Social Security at $39.05 times 0.75 will put him $100 over the Medicaid waiver limit. This is an impossibility for me. Thank you.
Thank you, Mark. Good afternoon.
Good afternoon, Madam Chair and members of the committee. My name is Diane Corsello, and I live in Richmond, Virginia. My son, Chris, is 31 years old and on the autism spectrum. He lives outside our home and has been working for Bon Secours for 8 years. He works 20 hours a week, same job, same wonderful private company, and he loves his job. He pays for his medical and his dental benefits through his job. He could not do any of this without the DD waiver and the services that he receives. My husband and I have worked collectively for over 80 years. When one of us begins collecting Social Security, our son will be impacted. As our disabled adult child, Chris will receive SSDI of 50% of my husband's or my benefit. To remain under the Medicaid income cap and retain his DD waiver, he will have to quit work. The difference between the SSDI and the maximum Social Security income of $943 is what we call $943, the SSDI income penalty. Worse yet, when my husband or I die, Chris will lose the DD waiver. We ask that you support House Bill 908, which will disregard the SSDI from a parent's record that exceeds the maximum SSI for financial eligibility of Medicaid. Your support will allow disabled individuals to continue to work, receive critical services, and remain in the community. And as Delegate Shin mentioned, an added benefit is that the state will receive more contributions from the individual for the care because of the higher SSDI. So thank you very much for allowing me to
Thank you so much, Diane. Thank you very much. Please, and if you can keep, I really appreciate you coming. If you can keep your comments to a minute.
It's 1 minute on the paper.
Madam Chair, members of the committee, I'm Dennis Finley from Fairfax. I'm the constituent who brought this issue up 6 years ago. My wife died in 2010 when my disabled son was 14. At age 28 now, he gets SSDI instead of the normal SSI on my deceased wife's work record. He has a community living waiver but cannot have a meaningful life job. His SSDI on mom's work record, a death benefit from the feds, is too close to Virginia's Medicaid income cap. It's now a death penalty for him. DMAS looked at this issue in 2020 study and came up with no solutions. What the study missed was that in 2019, Congress passed a bill that directed the Centers for Medicaid and Medicare Services to grant new authority to states to decide how to count income differently for waiver users only. The bill before you would implement this new authority. Eliminating the SSDI income penalty costs Virginia nothing as per FIS and will only add money to the budget going forward. Thank you very much.
Thank you so much, Dennis. Good afternoon.
Good afternoon, Chairman Duran and committee members. My name is Harry Gawanter. I have a 38, almost 39-year-old son with Down syndrome. He has been on a waiver since his adolescent years. He's been living in a group home now for 16 years and has a job down the street in the Omni. If I pass, when I pass, I guess that's, the if doesn't count, he's going to get kicked off the waiver. And right now, what this reflects is a difference between federal regs and state regs. And these need to be conjoined on behalf of people with disabilities. And the state makes money on this. They get drawdown federal dollars, and my son's now paying taxes. So thank you for your consideration.
Thank you so much, Harry. Good afternoon.
Good afternoon. Brian Kelmar on behalf of Commonwealth Autism. We support this. And as a parent of a 32-year-old autistic son who's on the waiver, just because I die doesn't mean his autism is going away. He still needs those supports. He would lose those supports the way the bill's written now. Thank you.
Thank you so much, Brian. Good afternoon.
Good afternoon. Terry Morgan with the Virginia Board for People with Disabilities. We support this bill. It's a practical solution to a problem that keeps families up at night and people home not working.
Thank you, Terry. Good afternoon.
Good afternoon, Julia Newton with SCIU, and also I have a son that's on the lower functioning scale of autism, and SCIU and I support this bill for all of the, I get emotional, for all of the reasons as stated. Thank you.
Thank you, Julia. Good afternoon.
Tanya Milling, the ARC of Virginia, very much supports this bill. Thank you.
Thank you, Ms. Tanya. We will go to our, let me ask for folks in the room who would like to stand in opposition to this bill. Great, thank you. We'll go to our folks who've been waiting so patiently also online for House Bill 908, and I'm going to do the same as ask if you can keep your comments to a minute or less so that we can allow everybody a chance to speak and share their stories. I'm going to start with Laura and Andrew Laverdieri.
Madam Chair and members of the committee, thank you so much for your time today and your advocacy. Our 33-year-old son, Andrew, who cannot be here with me right now, he's up chilling after work, receives a Virginia Medicaid waiver that funds supports so that he can live and work meaningfully like his non-disabled peers. His Medicaid waiver, however, precludes him from doing so. He has had to give up 2 jobs after working 5 years at each job with glowing reviews because coworkers and managers refused to accept the need to adjust his hours and rate of pay to stay under the income cap imposed by the waiver. Currently, disabled Virginians who receive a Medicaid waiver must count their gross earnings plus any Social Security insurance income. For us, it's his SSDI. For friends, the parents' SSDI towards their Medicaid waiver income cap. This income cap keeps disabled Virginians from working at all or prevents others from working the same hours and at the same rate of pay as their coworkers. In essence, his Virginia Medicaid waiver prevents him from working full-time. This has caused Andrew great hardship. He has had to leave 2 jobs after working 5 years at each because the coworkers and managers refused to accept the need to adjust his hours.
Laura.
It makes no sense to him. He cannot work like his peers because he has a Virginia Medicaid waiver. It has created great frustration for him, for his managers who wanted him to work full-time, and for coworkers who think he's not pulling his weight. This has led to debilitating anxiety and created more behavioral challenges.
Laura, I wanted
Yes.
to say thank you for sharing Andrew's experience.
Thank
and
you.
I appreciate you waiting for us this afternoon. And we're going to go to Alex Yellen. There you
Good
go.
afternoon. Yeah, my story is very similar to the ones you've heard. My son has had to dramatically reduce his hours. Unfortunately, so far, his employer is willing to put up with a much more part-time person than he did when he started there. But eventually, as SSDI goes up, he will have to continue to reduce his hours. And we are worried that at some time the employer is going to say, it's just not worth having somebody who can come in so rarely to work for us. And this is a job my son loves. He does it well. And he would like to have that for the rest of his life. But we are very worried that without this legislation, in a short time, he may have to leave that job. Thank you.
So much for sharing, Alex. Sheila Billingsley.
Hi, my son Zachary's a 36-year-old moderate functioning autistic. And Zachary's Medicaid waiver has enabled him to work in a supportive employment environment, recycling electronics since 2015. He loves his job, but unfortunately he has had to continually reduce his working hours. He initially started working 30 hours a week, but now to stay under the earnings cap, he's had to reduce them to 20 hours a week. And minimum wage and SSDI increases will likely result in more work hour reductions. And then my husband and I are concerned that in the future, the limit on work hours will impact Zachary's ability to work at all. I therefore ask for your support for Delegate Shin's House Bill 908 to disregard SSDI payments that exceed the SSI amount when calculating Medicaid waiver eligibility.
Thank you so much, Sheila. Pete Scampavia.
Hi, I'm Pete Scampavia. I live in my own, and when my mom retires, I'm going to have to quit one of my jobs. I want to keep Medicaid because I like doing both of my jobs.
Pete, thank you so much for coming today. Dr. Cherry Takamoto.
Hi, my name is Sherry Takamoto, otherwise known as Pete's mom. Many of you have had a chance to look at his apartment as he's wandered around with his iPhone. Pete's worked at the same job for 19 years, one job for 19 years. The other one's a new job. He's worked for 2 years. He gets to work at the assisted living where his grandma lives. And I am old. I get to retire at maximum Social Security age this year. And as a result, it's really sad. Pete has earned his own SSDI, but he'll have to go on mine. And as such, he's going to have to choose which job, the one he's had for 19 years or the one he's had for 2 years, both that he loves, he has to give up. It's not fair that a person with a developmental disability should have to cut back their work in a right-to-work state. And we hope that, I'm scared to death to die because who knows with all these crazy Social Security stuff, what's going to happen to him when that waiver we worked so hard for him to get is at risk. And I'm no longer alive to advocate for him. So thank you very much, Delegate Shin, for your work on this, and please pass this bill.
Thank you, Cherry. And again, thank you to you and Pete. Ms. Kristen Carlton.
Thank you so much, Madam Chairman. And I just want to say, as I run a special needs planning firm and I'm a mom of 2 kids with developmental disabilities, and my clients are afraid to die and they're afraid to get their clients jobs because of the way SSDI will impact their children's waiver. And I think every American deserves the ability to work and be integrated into the community. So I support this bill. I hope you will too.
Thank you so much. I have a Kathleen Walsh, but I don't see her in the room. Okay, Donna Burnett.
Hi, my name is Donna Burnett. I'm here in hopes of preventing my son from committing suicide. And let me tell you why I make that statement. It's really my story and what keeps me up at night. Brett has twice mentioned committing suicide. The first time was when he couldn't drive after making attempts for years to learn how. He has cognitive disability. The second one, when he's tried to become independent in independent living and his anxiety was too high for it. His identity is tied to work. His DD waiver provides the supported employment for him. My greatest fear is if he loses his DD waiver services when I die, he will not only lose his parent, he'll lose his job. And at that moment, I fear he will have no reason to live, and I won't be there to catch him. I need you to catch him with this legislation. I appreciate the time. Thank you
so much, Donna. Teresa Champion, I don't see her in the room. Pam Spearing.
Hi there, my name is Pam Spearing, and I wanted to tell you about my son, Jamie. He's been a 15-year employee at Costco. He loves his job and they love him. He's down to 12 hours a week to protect his waiver. He receives housing support through the waiver. My husband's in his 70s, and upon his death, Jamie and I will have to make a big decision. Option 1, quit work to maintain his waiver services, needing more support for the next 30 to 50 years as he sits at home, becoming at risk for mental and physical decline without the dignity of employment. Option 2, continue working and lose his waiver, his housing, and his support, becoming at risk for homelessness and incarceration. A parent's greatest fear and what keeps us up at night is what's going to happen when we die. Please support this bill. It costs you nothing if you do, and it costs us everything if you don't.
Oh, thank you so much, Pam. And Lucy is the last person that has signed up before the hearing started. Lucy Beadnell.
I'll only say I answer about 5,000 questions of the DD community each year, and one of the hardest I have to answer is to tell parents that when they die, their child may lose everything they waited for years and fought for. Thanks so much for your support on this bill.
Thank you so much. I think those are all the folks who signed up ahead of our hearing to speak about House Bill 908. The bill is in front of our committee.
Move to report.
Okay, so this bill has been properly moved and seconded to report, and it does not have to go to appropriations. So, Madam Clerk, if you can open the roll. Delegate Shin, House Bill 908 has been recommended to report by a vote of 8-0. Congratulations.
Thank you,
House Bill
Madam
909.
Thank you so much. Okay, one more. Madam Chair, House Bill 909 is a bill that directs DMAS to do 4 things in relation to the modifications for Virginia's Home and Community-Based Services, or HCBS waivers. First, we are asking to lift the 40 hours per week work limit for legally responsible individuals, or LRIs, with more than one waiver-receiving child. 2, we are asking to eliminate the excessively burdensome requirement that in order for an LRI to receive reimbursement for personal care services, no one else be able to provide those services to the member. 3, we are asking for respite care for LRIs. And 4, we are asking that a legally responsible individual or step parent be allowed to be the employer of record. The pandemic was the first time in Virginia where parents were allowed to be paid caregivers. And we saw a myriad of benefits, including less strain on the limited pool for hired caregivers. Family income stabilized as parents didn't risk losing their jobs or having to stay home with zero income to take care of their kids with complex needs. There was no rise in costs as a parent being paid. The paid provider does not increase access to the services that our state has already approved. The newly proposed rules that are due to kick in on March 1st make it nearly impossible for parents to use the parent-caregiver option, and it forces parents to have to prove that they're the last resort available to care for their kids, which is the opposite of how we treat families in any other situation. We heard some of that in the previous bills that we heard today. I think we'll probably get into the conversation around the fist that was put onto this bill, and I take a lot of offense at how big the fist was that came back, and we've done a lot of work in working directly with the House Appropriations Committee to figure out what a more accurate representation of the actual fiscal impact on this bill would be, and I'm happy to share that with members of the committee as well. Today, approximately 1,700 Virginia families are able to provide care as legally responsible individuals to their family members with a waiver. And many of these families actually live in care deserts. This has the potential to help families discharge children from publicly funded nursing homes, which is in line with the DOJ settlement. These proposed changes would also bring Virginia in line with a ton of other states who already provide this flexibility to their families. And I believe that we have a number of supporters here and who have written in public comments and potentially also online who would be great sharers of their story. You know, since being on this committee and on HHS, I've learned that one thing we like to talk about is where we stand in comparison to other states. We like to know where we are. And I thought I would share that some of the provisions of this bill would help us keep up with the rest of the country. So for example, right now, in comparison to Minnesota, Kentucky, Louisiana, Colorado, West Virginia, and Pennsylvania, we are the only state that would require that parents have to prove that no one else is available to provide these services. That's against, again, West Virginia, Kentucky, Louisiana. For respite care, we have specifically carved out parents who are caregivers from receiving respite care, and we would be the only state that would do that, where Minnesota, Kentucky, Louisiana, Colorado, West Virginia, and Pennsylvania do not carve out LRIs from being eligible for respite care. And so I think that I'd love for you all to hear the stories of the folks who are most impacted by these regulations that are due to take place March 1st and have an opportunity for the General Assembly to act before then. Thank you.
Thank you so much, Delegate Shin. I would just want to give an opportunity for questions from the committee first. Okay, I don't see any hands yet. I know that from DMAS, Mr. Lenardi is here, and we wanted to give you an opportunity to make comments as well.
Thank you, Madam Chair, members of the subcommittee. Jeff Lenardi with DMAS. I just wanted to clarify a couple of things on the timeline of this. In 2022, working with the General Assembly, there was budget language that directed us to work with CMS to submit a waiver so that we could continue the COVID flexibilities. Part of that budget language required us to include in that waiver that the family look for other providers and that no other providers be available. That budget language is still in place. I'm sure Susan Masser will identify that if it's the will of the committee to move these forward, but those two things will just need to be reconciled. And then the other thing I wanted to identify, and Delegate Shin identified this, is we currently have an approved waiver with the specific provisions in place that is going to go into effect on March 1st. So whatever the General Assembly directs us to do to change that, there will be a lag. And I just want there to be full awareness of that as we move through session.
Great. Thank you so much. Mr. Lenardi, I have a question for you for clarification. If the General Assembly moves forward with this bill and return to some of the flexibilities that were available to families in 2020, do those flexibilities continue to be available to Virginia to seek, and that we chose to make it harder with the new set of regulations that are coming forward?
I'm not sure I understand your question. Are you saying if you direct us, do we have the ability to apply to CMS to amend the waiver?
Yeah. Yes, those flexibilities still exist through the Centers for Medicare and Medicaid. They're available to us.
The ones that were in place during COVID that are currently in place, the provisions that are in our approved waiver will go into effect March 1st. So that includes provider of last resort, and that includes the respite care, and that includes some of the other provisions that this bill directs us to change. So those guardrails will go in place March 1st, and then if directed by the General Assembly, we will submit an amended waiver application to CMS, and if it is approved, we will then implement. And I'm getting that correct, right?
Yeah. Thank you.
Madam Chair.
Mr. Delegate Sickles, our Uber Chair.
So maybe one of the speakers here, we passed Delegate Cole's bill 1318 earlier, which has part of this in it already. Could you explain to us, or maybe the patron can explain to us, what 909 does in addition to the bill we passed earlier? And for your reference, that was 1318.
So Ann Bevan, Department of Medical Assistance Services. I just come up and start talking. 909 is different than 1318. 18 and 1282 that was rolled in, because it does add the respite component, which is not currently in what is approved for March 1st. That's the biggest difference.
Okay.
Delegate Shin.
Sorry, Madam Chair. Thank you, Madam Chair. I would also add that there is a couple of other elements that are different, because it's not just the respite care. The 1282 and 1318 only address must be the last resort piece, but 909 is seeking to address four things, one of which is respite care, one of which is the not having to prove that you are the last resort provider for parents. It also seeks to address the part where if you are a parent in a multi-waiver home, so you have two kids who are receiving waivers, that they are eligible for more than just the 40-hour cap. And it also says that we are asking for legally responsible individuals or step parents to be employers of record. So it does more than just that. Thank you.
Great. Delegate Orrock.
Yeah, Madam Chairman, given that right now, if I understood Mr. Lenardi, we're operating under language that was in the budget, and absent additional language, we've got nothing. And my concern, in recent years, as I recall, we didn't get a budget for some time last year. And so the point I'm getting to here, do we need an emergency clause on this measure so that then once signed by the governor, they could go forward with those provisions while waiting for the specific of some of the parts to come through the budget? And that's kind of to Mr. Lenardi and or the Uber chair, and maybe just something they need to ruminate over as this measure goes forward. But
I just want to be clear, what is approved by CMS right now that goes into effect March 1st, that will stay in place until we touch the amendments again. So if you want us to change that again, so once we touch the amendments, that's when it will continue to be the March 1st until such time CMS approves the additional amendment.
So, Ms. Ann, I think the answer, it sounds like to me, for Delegate Orrock's question is, even if we put in an emergency clause, it's not as if anything that we request through this bill can take effect immediately, because you have to go through an approval process with the Centers for Medicare and Medicaid.
Yes, ma'am.
Madam Chairman.
Delegate Orrock?
And yes, I understand that, but I guess then once we get approvals, if we haven't passed a budget, then it still can't go into effect until the budget gets there. And so I don't know that we do any harm by sending this forward with an emergency clause, because that would then allow them, as soon as they get the CMS waivers, they could immediately implement any of the provisions of this, whether we passed a budget or not.
Delegate Shin?
Thank you, Madam Chair. I would consider Delegate Orrock's suggestion of adding an emergency clause to the bill a friendly amendment.
I move the amendment.
Any opposed? All right, so the bill has been amended before us. Thank you. All right, we'll take, and I don't see any other questions from committee members, so we'll take testimony from our public. If you would like to testify in support of this bill, please line up. We'd like to give everybody an opportunity to speak since it's been a long day and you've been waiting. I ask you to keep your testimony brief to no more than a minute so we can hear from everyone. And we'll start off with you, Ms. Tanya.
Hi, yes, Tanya Milling, the ARC of Virginia. We very much support this bill. I really like the conversation about figuring out how it's going to work in reality. And I do wonder if DMAS could answer the question, because I don't know. If they apply to CMS, I understand that piece about the application. Do they get to act under their application? Does it go retro, or do you have to stay until you receive said approval? And that may not be clear, but I think Ann will probably know what I mean. The only other thing I was going to say, we very much support, we didn't mention the EOR. I do want to say that that's one of the issues Delegate Shin mentioned that is really important. Right now, I think that the intent of the agencies is to solve any perceived conflict of interest or that sort of thing. But EOR, employer of record, you're taking on liability, you're doing these things, and it's unpaid. So no matter who a family asks, it is a favor. So.
Thank you so much, Ms. Tanya. DMAS, did you want to answer her question? And I know witnesses don't generally get to ask questions, so DMAS, I think the question was, can this be retroactive or forward-looking but I'm sure you understood exactly that question.
No, we cannot ask for CMS, implement, and still await their decision, which can take up to 90 days.
Right, so then
And we
once
can't do it retro, it's only to the date of the
Forward-moving.
application.
Great, thank you so much. Thank you for being so patient this afternoon. Good afternoon. Good evening.
Hi, thank you, Madam Chair, and to our patron, Delegate Shin, thank you so much. My name is Catherine Ray. I'm here today with my father, Roy Greer, and my two boys, John, JP, I went formal there for a second. JP, he's 11, and my youngest son, Louis, who's 8. I represent one of the many families in Virginia who have multiple children with disabilities and extraordinary care needs, and I support all of HB 909. But just want to say a few words in particular about the 40 per hour work week limit for LRIs. Though our family has some very part-time attendant help, most weeks I'm the only person available to provide the full services my children qualify for to safely live their lives. Putting a 40-hour per week work limit on LRIs is an arbitrary cap that does not actually reflect the objective care needed, nor the full services rendered by the LRI, especially when caring for multiple children. Like the caregiver of last resort guideline that DMAS has put into place, this limit is not a CMS requirement. So I'll try to wrap up quickly. Just to withhold that full reimbursement to LRIs is to disregard the necessity of the services and to discriminate against us providers who are family members. So I just want to encourage you today to respect and actively support those of us who are LRIs who play this crucial role in our loved ones' care. Thank you.
Thank you so much for being here. Good evening.
Good evening again. My name is Donald Benson, and as I mentioned before, I recently adopted a 4-year-old who has severely been injured and is going to be in need of help for the rest of her life, more than likely. And my point now is that these new guardrails, we're not against guardrails. We feel like there needs to be regulation. There needs to be something there to protect against misusers. However, these guardrails compel many parents of minors to become employees of agencies. And this is a slap in the face and shows a distinct bias towards agencies and institutions and makes a mockery out of consumer-directed care and being able to make those choices for our children. So I would say that really this is something that seems like it's making it so that parents are assumed guilty until proven innocent. Thank you.
Thank you so much. Good evening.
Evening. I'll keep it brief. John Segel, again, parent of special needs. It's hard to, I fully support everything that was just said. And again, thanks everyone for really pushing this change. I'll just conclude with saying that I think, there's certain issues that transcend politics, and what I've seen with the bipartisan support, has been very, very humbling and just appreciated with this effort. And so, and even working, I know this is a complicated issue, getting to know some of the DMAS folks, that there's all right intent here to make this work, and it's just really appreciated. So it makes me proud to call Virginia home, and just really look forward to seeing this work its way through. Thank you.
Great, thank you so much. Anybody else? Oh, here we come. Good evening.
Good evening. Terry Morgan with the Virginia Board for People with Disabilities, and we support this bill.
Thank you so much, Terry. Good evening.
Good evening, Madam Chair, members of the committee. Ashley Wright, representing Virginia Access. We support the bill.
Thank you, Ashley. Are there any folks who would like to speak in opposition to this bill? Okay. I think we have some folks who are who've signed up online. I'm going to start with those who've signed up to testify for the bill. And a reminder to our witnesses online, please keep your remarks to 1 minute. I'm going to start with Lucy, who signed up to speak in support for the bill.
Thank you so much. Again, Lucy Beednell with the ARC of Northern Virginia. I don't think I can share better than what Delegate Shin and the families did, other than to say I spent Thursday of last week at ILIF, a nursing home for medically complex children in Falls Church, and we heard over and over and over that those kids were there because their parents couldn't find caregivers, and about the value of how those children may be able to be discharged and have a life in their community if their parents could be their paid caregiver and stabilize the family for the first time. time. And speaking on behalf of those kids, I would love for them to have that opportunity. This bill would allow it. Thank you.
Thank you so much, Lucy. We had one individual who signed up to speak against House Bill 909, and that is Marcy Tedderton. Marcy, if you can please keep your remarks to a minute or less. Thank you so much.
Oh, thank you, Madam Chair. Marcy Tedderton with the Virginia Association for Home Care and Hospice. I already spoke to the issues prior, but I do want to bring up two additional things. There are concerns about how this would potentially affect the cost effectiveness test for waiver services that are required by CMS, and how we would fundamentally change the definition of respite care potentially for all waiver services. Thank you very much.
Yes, thank you. All right, members of the committee, this one does have a fiscal impact and would need to be sent to appropriations. But House Bill 909 is before us, and I don't see any more questions, so we operate by motion.
Report and refer to appropriations.
As amended.
As amended.
As amended. All right, so we have a motion that's been properly seconded to report and refer House Bill 909 as amended to the Appropriations Committee. Madam Clerk, please open the roll. Please vote. All right, well, House Bill 909 has been recommended to report and refer as amended to appropriations by a vote of 8-0. Thank you so much, committee members. And so they moved us from the big committee room to the little committee room because they said, you're just this little committee. But by the sheer size of everybody here today and the weight of the discussions we've had, I think we do really good work. And we have another bill. Oh my goodness. Please forgive me. Oh my gosh. I was going to say we do such good work, but we are not done yet. My Uber chairman, House Bill, I don't even know, it's so late, 594.
Thank you, Madam Chair. This bill is now the substitute before you is Section 1 bill, and it is sought by the Community Health Workers Association, our hospitals, and Virginia Interfaith. And as most of you know, during the COVID-19 pandemic, community health workers played an invaluable role in engaging the community to ensure people sought treatment when they were sick and were able to get both urban and rural Virginians to vaccine clinics, among other things. So I'll just read the first line of the bill as it stands now. The Department of Medical Assistance Services shall convene a work group to design a community health worker services benefit for beneficiaries enrolled in Medicaid or in the Children's Health Insurance Program. The work group shall include representatives from the Institute for Public Health Innovation, the Virginia Community Health Workers Association, Virginia Health Catalyst, the Virginia Health and Hospital and Healthcare Association, Virginia Department of Health, and other organizations at the department's discretion. So this work group will see whether we can create a waiver for this function and this profession. And that's what the Section 1 bill does.
Thank you.
It does have a fifth, so it'd have to go to appropriations.
All right, I think that we have a substitute. Second. All right, the substitute's been moved and seconded. All those in favor say aye. Aye. Any opposed? Wonderful. Are there any questions for the Uber chairman? Are there any folks in the room who'd like to speak in support of this bill? Oh, I love this. All right, I'd like to... Please keep your remarks to a minute or less. I'd love to be able to hear from everybody who's waited very patiently. We'll start off. Good evening.
Good evening, Madam Chair, members of the subcommittee. I'm Davis Gammon with the Virginia Hospital and Healthcare Association. We strongly support the bill. Thank the patron and the many stakeholders who have worked on this. We know that when patients come to the hospital for care, they bring with them the circumstances in which they live. If patients do not have stable housing or healthy food, their health outcomes are proven to be significantly worse, leading to avoidable overutilization of costly healthcare services. This cycle of treatment, discharge, and payment continues to balloon healthcare spending and costs for all Virginia patients. Community health workers help to break that cycle to eliminate persistent healthcare disparities. It is critical that Virginia moves towards creating a Medicaid benefit for CHW services. It'll promote more robust and effective healthcare delivery while delivering cost savings to the Virginia Medicaid program and patients across the Commonwealth. In closing, I do want to recognize my colleagues at the VHHA Foundation who have done so much work, especially Adrian Hill, who has helped to make Virginia a leader in deploying CHWs. What community health workers do is healthcare and is vitally important to ensuring that every Virginian and every Virginia community has the opportunity to be healthy. I hope it's the will of the subcommittee to advance this to the full committee. Thank you, Madam Chair.
Great, thank you so much. Good evening.
Madam Chairman, members of the subcommittee, Becky Bowers-Lanier. I chair the board of directors of the Daily Planet, which is a federally qualified health center with the focus of healthcare, providing healthcare for the homeless. We are totally in support of community health workers and the fine work that they do, and we hope that you will pass this.
Great, thank you so much. Good evening.
Good evening. My name is, Madam Chair and subcommittee members. My name is Shantany Jackson, and I'm here today to testify in support of this bill. As a promotora de salud, a community health worker, and the executive director of the Virginia Community Health Workers Association, I have witnessed in firsthand the impact of social and health benefits that community health worker interventions provide to community members in both rural and urban settings. There is substantial research and data that supports the effectiveness and the efficiency of CHW interventions. These interventions have shown to improve health outcomes and well documented across the Commonwealth and nationwide. Therefore, I strongly support the creation of sustainable mechanisms that will reimburse community health workers for the services they provide to Medicaid members. Thank you so much.
Thank you so much. Good evening.
Good evening. My name is Stephanie Carrington. I'm a community health worker. I'm also the president of the Virginia Community Health Worker Association. I strongly support this bill, and actually too as well. Community health workers make such a difference in the state of Virginia and ensuring that everyone has a healthy life. Thank you.
Thank you so much. Good evening.
Good evening. My name is Myra Sanchez. Thank you, Mrs. Chair Trenton. And I know some of you for quite a time. I've been doing a lot of advocacy for my community. I'm a health worker, and we need help, really, because we have a lot of needs in the community, and we are so close to them in order to help them. I'm here to support this bill. Thank you so much. Have a wonderful night.
Thank you, Myra. Good evening.
Good evening. My name is Jane Hurst. I'm here to support the bill.
Thank you, Jane. Good evening.
Good evening. My name is Nanisha Dozier. I support the bill.
Thank you, Naisha. Good evening.
Catherine Haynes with Virginia Interfaith Center for Public Policy. Thank the patron, Delegate Sickles. We strongly support the bill. And also another coalition member, New Virginia Majority, is stuck in another committee, and they also strongly support the bill. Thank you so much.
Thank you, Catherine. Good evening.
Good evening, Madam Chair, members of the committee. Emily Moore with Voices for Virginia's Children. We also strongly support the bill and encourage you all to do so as well. Thank you.
Thank you. Good evening.
Ben Barber, Virginia Health Catalyst. Thank you so much to the patron, to the chair. We also support, and thank you again for your time.
Thank you so much. Good evening.
My name is Ronell Merrill, and I support the bill.
Thank you for being here. Good evening.
Good evening. My name is Tony Bland, and I support the bill.
Thank you, Tony. We also have a number of folks who've signed up online, and I'm going to call them in order. Please keep your remarks also to a minute so that everybody has a chance to testify. I'll start with Veronica Espinosa, if she's on. I don't think I see Veronica. Jenny Tabora. I don't see Jenny. Dariana. Yay.
Yes, good evening. My name is Dariana Segura. I support this bill.
Wonderful. Thank you so much, Dariana. Kimberly Dyke Harsley.
Good evening, committee. Thank you for the bill. As a certified community health worker here in the city of Lynchburg and Johnson Health Center and serving the counties of Amherst, Bedford, and Campbell, I support this bill on behalf of the clients and patients that I serve, alongside working alongside providers dealing with chronic illnesses for the patients and chronic care management, self-monitoring, self-management. This is very important, and we support the bill.
Great. Thank you so much, Kimberly. So I think that concludes our testimony tonight from the public. House Bill 594 as substituted is before us, members of this committee. And it would need to be reported to appropriations if you want to act favorably.
Madam Chair, I'd move to report and refer to appropriations as substituted.
Second.
There's been a motion properly seconded to report and refer with substitute to appropriations, House Bill 594. Madam Clerk, please open the roll. Please vote, members. And the vote is 8-0. Delegate Sickles, my Uber chairman, who I can't believe I forgot. I'd like to be on the public record. He is my children's favorite delegate. As we conclude a very, very long meeting today, it is our last meeting before crossover, and I'm so incredibly proud of our little committee in this little room doing such big and mighty work on a bipartisan basis. Thank you so much, committee members.